continue with our focus now on the Eastern Cape Scooter project and whether it will help curb the spread of COVID-19. Speaking to us now is Democratic Alliance's Eastern Cape Shadow MEC for Health, Jane Cowley. Jane, good evening and thank you for your time tonight. The minutes of the oversight meeting that was held recently indicating that there is, of course, a lot that is going on in the Eastern Cape Health Department, including a number of staff members who have been fired, including some who are leaving because they are unhappy with the remuneration, including, of course, the billions of rands in terms of litigation that the province is facing as far as the Department of Health is concerned. And then there is a launch of this intervention, which is 100 scooters, which are going to assist to navigate difficult terrain and be able to almost serve as a mobile stretcher, for example, to take folk to a clinic or to a nearby ambulance. What's your reaction?
Hello, Thabo, and good evening to the viewers. My reaction is quite a simple one. I think it's a diversion tactic, to be quite frank with you. There is, as you say, so much going on in this province which needs focus and attention and immediate attention. And yet the MEC sees fit to launch a program which is completely impractical for our province.
So as far as the impracticality of it, what do you mean, Jane?
Thabo, I do a lot of oversight, both on the eastern and western parts of this province, and I drive an old 4x4 bakkie, and I struggle to reach some of the clinics in the rural areas. I cannot see how on earth one of those scooters is going to cope with a pothole in a town, never mind a pothole on a dust road reaching a rural area. I would hate for one of my family members to have to travel in a scooter. The ambulances that were purchased 2 years back were 4x4 ambulances. Within a year, about half of them were so damaged that they could not be used anymore. I fail to see how scooters with skinny little tires are going to cope on any of our rural roads.
So what do you say to the MEC today who says this has been well researched, well planned, these scooters or motorbikes have got off-road capabilities, and they feel, having looked at this project happening, for example, in Uganda, this would be the perfect solution to the situation in the Eastern Cape?
I don't think we can compare Uganda to the Eastern Cape, firstly. Secondly, I think this was a very well-researched project when it was used in the First World War for patients to be taken to field hospitals. And thirdly, as I said earlier, I think this was a well-researched plan, but it was a well-researched plan to get everybody's attention away from the chaos that reigns in our hospitals and clinics as we speak.
The MEC feels this is a worthwhile investment of 10.1 million, considering that, in her experience, she's seen very sick people, pregnant women being transported in wheelbarrows at times to be able just to get to a clinic or to a hospital. So this is money well spent.
You know, Thabo, we are a province of approximately 6.7 million people. Now, according to World Health Standards, we should have one ambulance per every 10,000 people in the province, which would require that we need 670 ambulances on our roads at any given time. I can assure you that we have well then less than half of that number currently, and that is already a number that's been topped up. So it was about a third of the number that we required up until fairly recently. If we ensured that our ambulances were well looked after, maintained properly, serviced properly and speedily and timeously, and had enough ambulances on the roads to serve the people that they should be serving, we wouldn't have to see people resorting to taking family members to clinics and hospitals in wheelbarrows. So I don't buy that argument at all. I'm afraid it's another indicator of the systemic failure of the health department in this province.
How many ambulances, as far as you know, Jane, are in for service at the moment? The MEC says she's not operational, she's not an operative, so she can't commit on those numbers.
I know that, Thabo, I think it was last year I set a parliamentary question, and if I remember correctly, less than half the ambulances we required were actually on the roads. And this puts the emergency medical services under extreme pressure. So, they are so stretched, and of course it results in long turnaround times to fetch patients. So instead of patients having a turnaround time in the cities of 15 minutes, it's well over 45 minutes, and I can assure you it's even longer than that. In the rural areas, I know of clinics who have waited an entire day for an ambulance to come and fetch patients, and then sometimes the ambulance doesn't even arrive. 5 hours is the norm in rural areas, and it's just not good enough. We've experienced deaths as a result of children or young women going into labor and having problems with their labor, and the baby, the neonatal, has passed away, and so has the young mother, all because an ambulance reached them too late, 7 hours after they should have been there. So it's a tragic situation, but as I said earlier, if we look after the things that we have and maintain them properly and make sure that the servicing of those things and the turnaround time for servicing is on point, then we wouldn't be looking at scooters and wheelbarrows to try and get our people to clinics and hospitals in the first place.